welcome back. Of course, you're watching Morning Cafe, and today on Health Thursday, we're talking matters understanding kidney failure. And of course, we understand that there is a rising cases of kidney diseases or kidney failure in the country, and we also understand the enormous financial and just the emotional burden it places on family and individuals suffering from kidney failures. And to help us with this conversation is Monica Wanjiru. Monica is a general practitioner and a specialist in kidney health at Maya Kidney and Health. Monica, karibu sana to Morning Cafe. How are you this morning?
Thank you. I'm well today. Yeah, I'm looking forward to have a very insightful conversation.
We want to make them understand what kidney failure really is, right?
Of course, yeah.
So I want us to get straight to it. When we talk about kidney failure, right, the Kenya Renal Association estimates that approximately 4 million Kenyans are affected by kidney failure. That is an increase. When you talk about 4 million, your number ni kubwa sana, yeah? Are we looking at an increase, or would you say that as of 2025, there is a decrease in this condition?
Of course, there's a notable increase in the cases of chronic disease, majorly because of our lifestyle. Lifestyle is changing. Urbanization is also affecting the way our lives are. That is lifestyle in terms of previously, we used to be very physically involved, most of the tasks we used to do. But right now, mostly we are tending to lean on the sedentary life that is bringing issues of hypertension and diabetes, which are leading causes of chronic kidney disease. Yeah.
So when you talk about lifestyle, you mentioned saizi tunakaa tu, yeah? We are not really hyper like watu wa kitambo, yeah? But is it foods as well? What exactly is contributing to this? Tell us about that.
Yeah, of course, nutrition is part of it because most of the cases you find the leading cause of chronic kidney disease. First of all, let's maybe take it back. We need to understand what is a kidney.
Yes.
We have two kidneys. A kidney is a bean-shaped organ. It's a very complex organ in the body. So most of the people associate it with urine excretion, but kidneys have a lot of functions in the body. So one of them is excretion, where it balances the fluid and electrolytes in the body. There is also the aspect of hormonal. It helps in blood pressure regulation by use of a hormone called renin. There is also, it helps in metabolizing erythropoietin. Erythropoietin is a hormone that signals the bone marrow to produce red blood cells to avoid anemia. There's also, so when you look at that, most of the cases come from diabetes and hypertension. There's also polycystic kidney disease. There's also infection. There's also, when you talk about lifestyle, there's also medication that causes that. And when you look at our lifestyle right now, medication is very available in the counter. So people are going to the counter, they're getting medication. Most of it, they look very harmless. For example, like Brufen. Brufen looks very harmless, but at the long run or prolonged use of Brufen or NSAIDs, a category of analgesic we call NSAIDs can lead to chronic kidney disease. Yeah, so changes in diet. Of course, right now, most of the food is genetically modified, so the nutrition aspect is also a question in it. Yeah.
So you've said we do have two kidneys, but you see, in this day and age, we see conversations of people wanting maybe to sell their kidneys or maybe to give out their kidneys for people who have kidney failures. But can one really survive with one kidney? Ako sawa kabisa, no underlying conditions. Can we survive with that one?
Yeah, of course you can survive with one kidney. Now it depends on the state of the kidney, because when you look at chronic kidney disease, there's staging.
Yeah.
So there's stage 1, there's stage 2, there's stage 3. So when you have one kidney and one kidney is at stage 4 or stage 5, in terms of kidney disease, you might not. Your prognosis in terms of mortality will be very low. So you can survive with one kidney. Now it depends on the state of the kidney. Yeah.
And you know, they say that the black population is more predisposed to kidney failures. Why is this the case? Black people, we see fibroids, black people are more predisposed. Right now we are talking about kidney failure, the black population and the Asian population. Why is it the case?
So mostly it's because blacks are more prone to getting hypertension and diabetes. And the reason to that is we've been economically, there has been an economical injustice. And you find most of the people are not well economically. So that piles back to the fact that health-seeking behaviors are wanting in the black population. So most of the time, when you're diagnosed with maybe hypertension or diabetes, you're not able to seek the right treatment, adhere and also be compliant to the treatment. Because something you need to understand, chronic disease is not an independent diagnosis. Most of the time it's a secondary diagnosis. So there's always an underlying condition. The only time that you find maybe you have kidney disease that is directly associated with the kidneys is in case you have infection to the kidney, or maybe kidney injury, maybe from an accident or something, or an assault. But most of the time, majorly, the major cause of kidney failure is diabetes. There's hypertension that follows. There's polycystic kidney disease. There's vascular diseases. So you find most of the people, when they're diagnosed with the hypertension or diabetes, they're not able to adhere to the treatment plan because of the socioeconomic status, and mostly the adjustments that are needed in life, they're not able to comply. And that leads to now the kidney disease. Yeah.
How about genetics?
Okay, genetic predisposition is one of it. Also family history is one of the reasons why you might be predisposed to it. Mostly genetic, you will find in case you have malformation of the kidneys, maybe you're predisposed to polycystic kidney disease genetically. Yeah.
You know, we're talking about understanding this kidney failure, but tell us the impact it has on other organs in the body should it fail.
So remember, once you understand the functionalities of a kidney, now you understand how everything is related. First of all, the function of the kidney is regulation. You regulate your fluid and electrolyte balance. So if your kidneys are compromised, you're not able to excrete properly, it means you have fluid overload. When you have fluid overload, it means now your heart is starting to overwork. When your heart starting to overwork, now you get to heart failure. And then supply to major organs, maybe like pancreas and all that is reduced, leading to cell death, and mostly you end up with diabetes, and also circulation to your peripheries, that is your legs, your hands, is also compromised. You lead to neuropathy. That's how you end up with issues of neuropathy. There's also now the metabolism of erythropoietin, that is a hormone that stimulates the bone marrow to produce red blood cells. If it's compromised, now it means you're not able to produce enough red blood cells, so you end up with anemia. And then most of the time you end up with issues of overbleeding because you're producing enough platelets, but the functionalities of the platelets is very low, so you end up with anemia. So are there any age group or demographics that are more predisposed to this? We've talked about now the population. The black population are more predisposed. Now let's talk about the age group. So mostly you find previously the statistics are different, but now everything is changing because of the issues I've talked about: health-seeking behaviors, urbanization, improved genetically modified food. So you find that Kitambo, we thought that older people would be more predisposed. But right now we're looking at a mean age of 40 years because hypertension is starting as early, and diabetes is starting as early as even 20 years, between the 20 years age gap. So now statistics are changing. So right now we cannot assume that this is an old age issue. So we have to cut across when it comes to preventative measures. Yeah. You know, I was watching a story of a 13-year, she's 26 as of now, but she said she was diagnosed with kidney failure at 13 years of age.
So someone at 13, really, what is the underlying cause for that?
So for children, mostly you find the major issue is genetic and family history. So genetic, where we talk about malformation of the kidney structure. There's also early onset diabetes, that is diabetes type 1. Diabetes type 1 is mostly happens in young people. So that is one of the other predisposing factors. There's also infections in the kidney. You find maybe the child has been having glomerulonephritis, that is infection in the kidney that compromises the function of the kidney. Maybe severe infection that may be led to sepsis shock that affected the kidney circulation. So mostly in children you find mostly it's just genetic infection. Those are the major causes of kidney disease. Yeah.
Now looking at statistics globally and region-wise, Kenya, how do we compare?
Of course, Kenya we are catching on because now we are having the privileges of the processed food that is high in salt. We are having now packaged food, and now the sedentary lifestyle that we are adopting along the way. So the statistics are increasing. Like as of 2020, we had over 7,000 people across all the hospitals that had kidney issues. And remember, there's still other people they were not really captured statistically, because you realize early stages of kidney disease, you don't get to experience any symptoms. Symptoms start appearing maybe from stage 4, stage 5 there. So most of the time, they're incidental finding from lab test. So we are catching on due to our lifestyle. Yeah,
we are on the right path, right? So when we talk about symptoms, you know, we are in an era where Google is also here, and we know Google can sometimes exaggerate. And you're talking about fatigue, nausea, swelling in the feet, tiredness, same symptoms, just like having a fever. But now, how do I know that no, this is a sign that I'm having a kidney failure?
So it's not cast on stone because those are shared symptoms by other diseases. So that's why we always insist. I'll pose a question to you. When was the last time you had your annual checkup?
Was it in 2022?
Exactly. It's supposed to be done annually. Because some of these things, that's why we, at Maya Hospital, we're looking at preventative measures rather than curative. So but you'll have the fatigue, of course, because of the anemia. That means you have low blood levels. You'll have the edema, that is swelling, and it start gradually. You start from the feet to the level of the ankles, on and off, on and off. So most of the people assume most of the symptoms because they're not so dramatic. So you might end up missing out on the symptoms. So by the time most of the people are coming to the hospital, they're at the maybe stage 3B or stage 4, stage 5. And then there is also shortness of breath because of fluid accumulation in the lungs, that is pulmonary edema. There's also the gastro issues, that is the weight loss, you experience loss of appetite. So the symptoms are very staggered. You can't be sure. You have to also correlate with biochemical tests to be able to ascertain that, yes, we have a kidney disease. Yeah.
You said at stage 1, someone might not really know that they have kidney failure because symptoms are sometimes not even there. At what stage does one start to actually notice these signs and symptoms, or maybe even getting diagnosed with kidney failure?
So mostly from stage 3B, that's when you start getting very subtle symptoms. You wake up in the morning, your feet are swollen to the levels of the ankle. Maybe because you're moving around, they'll settle down. So most of the people assume the symptoms. By the time you're getting to shortness of breath and all that. But that's why I asked you, when did you last do your annual checkup? Because kidney testing, most people assume it's very expensive. It starts as low as a urine test. A urine test can tell us how your kidneys are functioning because we check the level of proteins in your urine, the level of blood in your, if there is any blood in your urine, and if there is, now we go further to blood testing, imaging and all that to be able to ascertain also the staging. So from stage 1 to stage 3A, you might not experience any symptoms. They're just incidental finding in the lab test. Yeah.
So at what point point does it get severe? You know, when we're looking at maybe cancer, for example, it also has stages, just like this kidney, and there's a point where it gets too severe. At what point does kidney failure get severe?
So it starts from stage 3B. So that's when you start experiencing very subtle symptoms. By the time you're coming with shortness of breath, severe fatigue, bone pains and all that, we're looking at end-stage kidney failure, where now we have to consider dialysis and all that. So the symptoms are subtle. So don't assume, because most of these symptoms are shared by other conditions. Remember, even heart failure can give you shortness of breath, will give you swollen feet and all that. The next thing is you have to have what other countries are doing that we're not doing is having a family doctor. Because healthcare in Kenya is very fragmented. And that's why I was still insist on the health-seeking habits of Kenyans. Because what happens with Kenyans, today I have swollen feet, I'll wake up, go to my local clinic, I'm given some meds, I go home, I take, it doesn't feel better, I'm like, no, that clinic was not okay, moving to another clinic. And remember, all these hospitals are now communicating. So you're starting on a clean plate every time you go to another facility. So by the time they're catching on, the progression of the disease has gone to almost end-stage kidney disease. And remember, kidney disease is not reversible. Yes, there are two types of kidney disease. There's the acute that is caused by maybe sudden decrease of your kidney function. Basically, maybe out of maybe bleeding or maybe an obstruction in your ureters that drain the urine to the bladder. And most of the time, if you remove the offenders for the acute kidney disease, you might be able to reverse the damage or halt the damage. But when you get to chronic kidney disease, it means that it's not irreversible. It keeps on progressing. So the earlier you catch it, the better, because you're going to halt or reduce the disease progression. Yeah.
Let's say it's at stage 1. Can't it be treated kabisa kabisa? Now you say I am free, I am healed completely. Okay.
When it comes to kidney, remember, it's not an independent diagnosis. It always rides on the primary diagnosis. So it depends with the causative factor of the kidney failure or kidney disease. So like I said, for example, if you're talking about kidney failure because of kidney stones, once you remove the kidney stones, you're okay. You can move on. When you talk about cancer, that is now progression, because now the cancer, you have to go through chemotherapy and all that. And you talk about heart failure. When you talk about hypertension, most of it is not treatable and not reversible. But for acute cases, maybe you lost blood, maybe you had an accident, and then you went into anemia. Once you correct the anemia, you can be able to halt or reverse most of the damages that happen.
Of course, I want to remind our viewers that we have a number on the screen. Colin, Daktari is here to help us talk and to help you understand the kidney failure. Also, we are live on Facebook and YouTube at TV47 Kenya. That is the handle for both Facebook and YouTube. Now, how reliable, Daktari, are the current diagnostic tools for early detection for kidney failure?
Very reliable, because kidney is very straightforward. We start with the basic urine test. When we do a urine test during the routine, as I said, the annual checkups, when you do a urine test and you find that your urine has blood or protein, of course, the first aspect is the kidneys, because that's where the urine comes from. Now we go further and test for creatinine levels. So creatinine levels, now with the creatinine levels, we are able to stage. So what we do is something called a GFR, that is a glomerulonephritis rate. So now that is calculated by your creatinine level, your age, and your gender. Now that will inform the stage of the kidney disease. So above 90% functionality, you're at maybe stage 1. And it goes down to the below 15, that's when we talk about now end-stage kidney failure, where you need support in terms of dialysis and all that. And then if we're querying maybe cyst and all that, we can go to imaging where we can do an ultrasound, we can do CT scan and MRIs. So a urine test basically, like take a random guess, how much is it?
I can't.
I can, as low as even 150 shillings. And that will inform the doctors how if we're having any changes. A creatinine test, leave alone the full kidney function test. Just a basic creatinine test is below 1,000. I believe that is something every Kenya can afford per year. And it's actually not every day, it's per year. Just to check how your kidneys are functioning. Yeah.
150 Kenyan shillings. We are taking a break at this point. Of course, you're coming back with this conversation on understanding kidney failure. Stay with Morning Cafe.
Are you ready to elevate your business game?
As long as you're earning something, there's always that opportunity to save. And you start with where you are.
Kama wewe ni mfanyabiashara, huwezi kaa bure, unajipanga taratibu vile inavyofaa.
Join us each week as we dive into the stories of the world's most driven entrepreneurs.
When you pay attention to detail, you get luxury items.
The Grind, where business meets brilliance. Tune in every Monday at 7:30 p.m. because your business deserves the best.
Hey there, friends. Welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
We're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get
All right, welcome back. You're watching Morning Cafe, and the conversation you're having this morning is kidney failure. Do you know what kidney failure really is? And before we went on that very short break, we were talking about urine testing. It costs only 150 Kenyan shillings or 100. That is according to Dr. Monica is in studio to help us with this conversation. Now, you see, Dr. when we talk about urine, we were having this conversation. For girls, for women, when we hear urine testing, often we think about pregnancy. But you're telling me about urine having very many, there's so many reasons as to why urine is tested. So maybe you can pick up from that.
Yeah, of course, one of the tests that we do is pregnancy, because it will inform us the HCG levels. A hormone is released in urine, so we'll be able to tell if somebody is pregnant after 14 days. And then secondly, we test how the filtration, how the kidneys are able to filtrate, because proteins and blood, we call they are macro elements, so they're not supposed to be found in urine. They're supposed to be filtered from the kidneys. So if they're present, it means the kidneys are compromised. There are things like infections, so those are informed by the nitrate levels or pus cells. And then there's some micro bleeding that we check with the epithelial cells, or if there is infection and all that. There are ketones that also indicate maybe your sugar levels also in urine. So urine has so many elements. It's not only about pregnancy. There's a lot we check in urine.
All right, and we're talking about diagnostics. I understand that maybe, is there disparity in the rural areas as compared to the urban areas when it comes to diagnosis for this?
Definitely there is, because most of the people, we've seen people in the urban area more proactive with seeking advice from the doctors, unlike people in the rurals. And basically, I know most of us have gone through the rural setup.
Yeah.
And when you had a headache, what was the most common remedy?
Panadol.
Panadol. Yeah, most people in the rural areas, because they don't want the struggle. Of course, accessibility is an issue in the rural areas. And like here in the urban center, if I walk out of here, I'll find a pharmacy, I can find a clinic. In the rural areas, you find people have to travel for long distance to be able to find a health facility. So you find they find easy ways, or maybe they just, most of the time when you had a headache, your mom could ask you, how bad is it? For them to get you that they're going to take you to the hospital.
Yeah.
So most of the time you find accessibility, affordability is an issue when it comes to seeking health services. And also most of the time, if it's not pain, you've realized that most of the symptoms that make people come to the hospital are symptoms that are affecting their day-to-day lives. But people sit on symptoms that you're able to function daily, but you have the symptom. For example, when you wake up with swollen feet and along the day the feet are okay, most of the people will be like, oh, I get used to it. So you assume it. So most of the people will seek services when they have more dramatic symptoms like pain, shortness of breath, and that now affects their quality of life. Yeah.
Tell us about the treatment options for kidney failure.
So it depends now. We start with the first and foremost, before we even get to end-stage kidney failure, is lifestyle modification is the best. Because we always insist, at Maya Hospital, we always insist, if you have diabetes and you have hypertension, we are trying to avoid progression. Progression is by making sure your adherence to your medication and your vitals are within the normal range. When it comes to your weight, very simple things. I know most people like owning up, like my pressure inakuanga hapo haibadilikangi, and the doctor is insisting your pressure is very high. So managing the comorbids that are pre-existing, weight management is also one of it. There's diet and nutrition. There is also physical exercise. For example, nowadays I know you come to work, you barely walk. You're using lifts. That extra effort of deciding, no, I'll not take a lift today, let me walk. At home, a bit far from your home and walk home. It's also a form of exercise. You can do aerobics. The best thing with now, we have technology. You can use a YouTube and you're able to do some exercises at home. That is the first part. That is lifestyle modification. There is also medication that's able to control now the underlying condition. Now depending, is it hypertension, is it diabetes, is it maybe it was kidney stones where you can go for a surgery and they're removed, is it a blockage on the ureter? That is surgical. Now we're going to surgical, there's medical, and now there's also the psychosocial, because it's so traumatizing for you to wake up one day and you're told for your survival you have to take a pill every morning. Of course, your quality of life, you'll be affected, and now you don't know, you need a lot of health education also is part of it to be able to understand I'm not doomed to death. There's a way that I can manage my condition. So it's a multidisciplinary approach. It can be done so from nutrition, physical, wellness, medication, surgical, and all those interventions have to be interlinked. And then we go to now end-stage kidney failure, where now your kidneys have lower than 15% functionality. Now we have to consider cases of dialysis. We have peritoneal dialysis, we have hemodialysis, and if that is not optimal, we can now start thinking of kidney transplants. Yeah.
Now that we're understanding this topic, what is dialysis?
So dialysis basically is just removal of waste because the main function of the kidneys is removing excess fluid and waste from our blood. So that's what dialysis does, and it's done in two ways. There's hemodialysis. Hemodialysis is basically just for everybody to understand, it's just having an external kidney. So the dialysis machine is an external kidney that helps now because your kidney is fully compromised, it cannot be able to filter out the toxins and the excess fluid. Now your blood goes through the dialysis machine, is able to remove the waste and the excess fluid. And then we have peritoneal dialysis, which is done where we divert now the toxins to your abdominal lining for filtration. Yeah.
Now, how do you come to the point now you decide that this patient needs peri and this one needs hemodialysis?
So most of the time, peritoneal is done early stages because it's not optimal. So if it fails now, that's when we decide to go to the hemodialysis because it's optimal. Yeah.
So at what point does one now is eligible for kidney transplant? Is it at the end stage when now one begins dialysis, or it can come early on?
So if your disease, of course, this has to be informed by a number of factors, because if you're at stage 3 and your disease progression has been very rapid, it can be recommended to do it earlier.
Just hold on to that. All right, Wanjiku is calling us from Murang'a. Wanjiku, good morning. How are you?
Napiga kutoka Murang'a. Nilikuwa nauliza kama kufura miguu inaweza kuwa ni figo.
Okay.
Nimekuwa nikifura miguu 1 month now.
All right, asante sana. Daktari is here.
Okay, yeah, that is one of the symptoms. Remember, we said these symptoms are shared. It might be heart failure, maybe it's not there. Okay, when it comes to diagnosis, you cannot give me one symptom for me to confirm whether it is. So we have to take, we say in medicine, your diagnosis is derived from 80% of your history taking. So there's a lot that we need to collect in terms of any underlying issues, but for sure, swelling of the feet is one of the signs and symptoms of heart failure and kidney disease. So she needs to go to a facility and have a proper history taken and proper lab test done to be able to ascertain that that is kidney disease. Yeah.
So Wanjiri, you have it. You can go for checkup, right?
Yes, yes. She can come to our facility.
Okay. At Maya.
At Maya. Actually, we are located.
You only specialize with kidney diseases?
No, I didn't give a brief about the facility. So Maya Hospital, Maya Kidney and Health Specialist Hospital is a hospital that is more biased on renal care. So we have a capacity of 40 dialysis machine, but we do all specialty. So if you need oncology, if you need orthopedic, cardiology, and all that, it's only that now that we have a dialysis unit, we're more biased on the renal part. Yeah, but you can get all the services in Maya.
All right. Before that call from Wanjiri, you were telling us about how now you come to the decision to give a patient peri or hemodialysis.
Yeah, that's what we said, that peritoneal, it's in the early stages. So once, of course, your symptoms will inform the doctor when you need to move to maybe kidney transplant or hemodialysis. So if you're doing peritoneal dialysis and you're not improving, you're still swelling, you have electrolyte imbalance, you're having shortness of breath, that is pulmonary edema. So that's when the doctor will recommend, let's move on now to hemodialysis. If hemodialysis is not improving your quality of life, now we can decide like to look for a donor and do a kidney transplant. Yeah.
All right, we have another call, Dr. Nyaga from Kangemi. Good morning.
Morning to you, doctor.
What is your question?
Nakuanga na ugonjwa ya roho. Nakuanga na ugonjwa wa roho. Sasa. Hello?
Hello, we can hear you.
Okay, nauliza. Nakuanga na ugonjwa wa roho.
Okay.
So,
Nyaga?
Sasa. Swali yangu ni magogeti. Lakini tukojoa sana ili kulingana vile na kukojoa.
Songa mbali na TV ndio tukusikie.
Halo? Okay, sawa.
Punguza volume ya TV.
Halo?
Punguza volume. Now ask the question. Nyaga.
Ngoja nipunguze volume. Yes.
Sasa uliza daktari swali.
Nauliza. Na kuanga na ugonjwa wa roho. Na natumianga hii dawa za kutoa maji, hii Relaxis. Lakini of late kulingana vile na kunywa hata hiyo maji na natumia hiyo dawa. Hiyo sikojoi na hii sikojoi sana. Na saa hii nasikia hata niko na bit of congestion kwa kifua. Na sasa nilikuwa nimeenda hospitali Kiambu last week. Nikapatiwa dawa zingine za Relaxis. Nikapatiwa dawa zingine na kuanga na ugonjwa wa na kuanga na sulfa. Na kuanga na sulfa sikunyonge Septrin. Wakanipatia Septrin wa makosa. Sasa hiyo Septrin inanisumbua. Nikikojoa nasikia hata hii kitu ya kukojoa ikiwa na uchungu. Miguu iko na kama imechomeka. Sasa nikauliza hii ya kukojoa imefanya naona gani?
Okay. Asante sana kwa swali lako Nyaga, daktari.
Yeah, Nyaga, so when it comes to underlying condition, he says he has a heart condition. So remember, the heart and the kidneys are like brother and sisters. So they work together because when blood is pumped from the heart, it has to go through the kidneys for filtration. So you find if you have heart failure, most of the time if it's not well controlled, it leads to kidney failure. And if you have kidney failure and it's not well controlled, it leads to heart failure. So they are very connected. So he says I don't want to discuss his diagnosis as much, but it seems like whatever treatments he's on needs to be rechecked. Because remember, even some of the medication that are given, he said he has gout, some of the medication that are given for gout and arthritis and pain are nephrotoxic. So you might find, so there needs to be a lot of, the doctor needs to factor in the fact that is the patient having compromised kidneys and all that. And when you're having heart failure and hypertension or any other comorbid, we always insist that the patient should always have an annual checkup to check the baseline, like the creatinine, the protein, because those are leading causes to kidney disease. So the best advice for him is to go to a facility. He can come to Maya. We are located at Upper Hill KMA Center. He can come for a review so that we can go through everything, the heart, the kidneys and all that. We can do the baseline checks and then be able to advise, is it that the kidneys are becoming compromised? Because most of the symptoms as mentioned, like is having shortness of breath, the urine output is low, but also he talks about the pain during urination, which
Maybe
can be...
you can hold on to that. We pick this one before he runs away. Tom, good morning. Tom from Kakamega.
Yes, good morning to you, studio. My two questions are, one, is there any medication you can take instead of going for operation when you have kidney stones?
That is one.
Is there any medication you can take instead of going for operation stones, to operate stones to remove the kidneys?
Okay, that is one question. What is the other one?
The second one is, why is it most of the men block their urine most at the old age? What normally happens?
Thank you so much. Your swali kwanza ya operation.
Could you repeat? You said operation of the tonsils?
Yes.
Oh, okay. So when it comes to tonsils, there's hypertrophy.
Is it stones? Kidney stones?
No, the stones.
Yes, kidney stones.
Yes, of course. So there's some it depends. Everything depends on the staging and the severity. So if we are on early stages, there are medication that can be given to be able to dissolve the crystals of the stones. If it's severe now, then there are also surgical intervention that can be minimally invasive surgical procedures that can be done under an ultrasound. Or if they're very huge, that's when you go to open surgery. So everything depends on the stage, the severity. Yeah, so there are all those options. There's medication, there's minimally invasive surgery, and now there's open surgery to deal with that. Yeah.
He asked another question about why men do something. Why men? Director, maybe you can remind me about it. Why men? Okay, we could come back. Or blockage in old age. That was the question.
Oh, okay. So mostly you find as men age, there's something common that's happened that is called benign prostate hyperplasia. That is enlargement of the prostate. Enlargement of the prostate now causes the blockage of the ureter. That is the tube that brings urine to the bladder. So when there's blockage, it means now you're not able to. Most of the signs are maybe the stream was so strong. Now you're just dribbling next to your feet. Maybe there's pain, but mostly the stream of the urine, and now the urine output goes down because you're not able to pass the urine. Yeah.
All right. And you see, Nyaga was talking about he can't be able to urinate kama kawaida. What is the problem?
So that is, we have to look at how old is he? Is he prone to getting now what I've said, benign prostate hyperplasia? Is it a blockage? Is it an infection? Because it talks about pain. So we need to look at, is there any discharge? And then we can ascertain, is it an infection? Is it a blockage? Is it maybe the medication is messing up with the kidney? Because some medication can cause vasoconstriction, and that causes compromise in the kidney function. Some of the medication are nephrotoxic that can cause compromise of the kidney function. Yeah.
Speaking of treatment, how accessible is the kidney treatment in the country?
Okay, I would say it's accessible. It depends now with what stage we're talking about. Because early stages we're doing lifestyle modification, dealing with the offenders. The offenders are the underlying condition. So if you're talking about hypertension, I know we have done so many wellness as the hospital, and most of the time when you go to a wellness and you tell somebody you have high blood pressure, most of the time they go straight to denial.
Just hold on to that.
Yeah,
Just hold on to that. Tom is back. Tom?
Yeah. Hello.
Hello.
Is there any food they can eat to reduce salt from getting into the kidney? Hello? Yes.
Yes, we've gotten your question. Any food that one can eat to prevent it?
Is there any food you can use to eat, at least to reduce the kidney from the kidney?
Okay. Doctor?
Dietary intervention only works when we're doing prevention. When we're doing curative, okay, it's something that supports the curative treatment. So most of the time we have to resort to now medication, surgical, minimal invasive surgical surgeries, any open surgeries. But diet is also good, because now when it comes to diet, when your kidneys are compromised, you have to avoid some food, for example, like salt. And salt, most of the time we assume the salt we take from the food, but the processed food, like take an example of crepes. When you look at crepes, they are very salted. So those are salt that we assume, especially from packaged food, that also increase our dietary intake of salt. That is, increases the level of sodium in the body. When sodium is high, there's also high water retention. So those are the food that mostly you need to avoid. But basically, when you get to curative, you have to go to the conventional ways to treat. Yeah.
I hope Tom is satisfied with Daktari's answer. And of course, we're here to answer more questions if he has any. Now, we were talking about the accessibility of kidney treatment in the country. Are we doing enough to ensure that it's equitable and affordable to each and everyone, maybe those having kidney failures?
Okay, there's two ways to approach this because when you look at insurance coverage in Kenya, we're looking at less than 15%, both public and private insurances. So those people, we can say they are taken care of. But when it comes to accessibility of services, I believe accessibility is there because there is now the private facilities that support the public support the public facilities. Like SHA is fully covering for dialysis. In our center at Maya Hospital, dialysis is fully covered on SHA. So if you're doing dialysis, you only worry about logistics to get to the hospital. So access is now dependent on the person. It's accessible on the public, it's accessible on the private sector. So where the rubber hits the road is most of the time the GPs are more accessible, the general practitioners, but there is escalation. At a GP level, there's what we can do. And mostly you come to the facility, you find a GP, they tell you you're having signs of maybe kidney disease. They escalate it maybe to a physician, but you find most of the people don't follow up. Instead of following up, they jump from hospital to hospital. Yeah.
So, Dr., are there gaps in the policy framework around kidney care in Kenya? Hold on to that.
Okay.
Nyaga, good morning. Nyaga is on call. Good morning. What is your question to Daktari?
Yeah.
What is your question?
My question is,
Nyaga, toka kwa TV. Punguza volume ya TV.
Yes.
Ask your question now.
Hello?
Hello, ask your question.
I'm Nyaga, I'm 3 years old.
Nyaga?
Yeah. Yeah, I'm 3 years old. My question is, and for one, I'm a candidate.
Can you get it, Doctor? All right, Nyaga, we can't get you clearly. We'll be coming back to you later on when you are able to fix that. We were talking about the accessibility of, or the policy framework around kidney care in the country. Is it actually nice, or are there gaps surrounding it?
I'd say in Kenya, basically when it comes to dialysis, when it comes to treatment plan B, that is medication and all that, they're available. And the fact that the government is working so hard to achieve universal health coverage with the SHA introduction, and the fact that SHA covers for dialysis fully, I believe it's a work in progress, but we'll get there. But of course, in the private sector, when it comes to chronic care management, those are areas that we're trying to ensure that the patient are taken care of holistically. For example, at Maya, we have a program delegated for chronic care management and wellness that look as preventative, curative, and palliative. So that ensures that the patient in the program is well taken care, there's education and all that. So it's a work in progress. Both public and private sector have to come together and ensure we're working together, because chronic disease, it's a multidisciplinary approach. Yeah.
I want us to talk about transplant options. We had started with this before we received a call, but how accessible is transplant options in the country locally?
Okay, that is accessible at level 6. And of course, in terms of surgical transplant and specialty, is something that we are catching on to because we are having high rates of failure. Yes, there are transplants that are happening, but failures are also very high. So that's why you find most of the people, they fly out to get a transplant. So in Kenya, we're still working on it, and mostly it's only accessible to a few hospitals that have this specialty to be able to do the transplants. But of course, we're inviting, like we're trying to encourage medical second opinion externally to ensure also we improve our expertise in terms of transplants. Yeah.
You know, I cut you short. You're telling us about at what stage now there's a patient is eligible for a kidney transplant.
Mostly preferably at when your kidney are below 15% functionality, that is end-stage kidney failure, and you're on dialysis. So that's when we encourage the patient to start thinking of a transplant and considering donation.
Of course, as we wind up, let's talk about prevention. Prevention is better.
Of course.
But it's better than cure, of course. Now, how can we now prevent this from spreading? It's a national health crisis as it is at the moment. So how can we now prevent it both nationally and at a community level?
So first things first, you have to look at what causes, because we said kidney disease is not an independent diagnosis. So the causes will enlighten you on how to take care of it. So for example, when it comes to annual checkups, we always insist basic things: urine test, creatinine test, full blood count are things that can inform the doctor that something is happening, to be able to catch these things early. When it comes to hypertension, we talk about when you're diagnosed with hypertension, diabetes, ensure you are adherent and compliant to your medication and you're keeping your vitals within the normal range. There's lifestyle modification. We're talking about weight management, physical exercise, drinking alcohol, quit drinking or reduce to the recommended levels, smoking also. And then when there's infection, you ensure that you take your full course of medication. There's also other courses, like for example, contrast imaging. You only tell your doctor this should be done when necessary because of the ink compromises with the functionality of the kidney. Over-the-counter medication. I know some patients have owned up to some abnormalities. Shaisikia mtu akisema ulcers zangu, pneumonia yangu, they have already owned up to some of the abnormalities. So you find when they have those heartburn, they run to the facility to a chemist, they buy some of these common medication like omeprazole, the capsule, which is a PPI that is known to cause, prolonged use is used to, to cause kidney disease. So avoid over-the-counter medication, and if you have family history of kidney disease, it's good to ensure that you have and you seek advice prior to anything happening. Also, changing our health-seeking habits. In the West, they have this My Family Doctor. So family doctor ensures that beyond all this fragmentation of information, they are able to consolidate everything that you're getting from your specialist, from the GP, and be able to advise you. Because you find most of the people have gone to different specialists, they have different medication, and those different medications, they are antagonizing. Some of them are nephrotoxic. So changing the health-seeking habits of Kenya, and then embracing prevention methods, that is annual checkup, wellness, make sure you do your wellness. We do, as Maya Hospital, we do wellness for corporates and both individuals, just to ensure that your body is functioning optimally. And then make friend of your nutritionist, your psychologist, your GPs. They should be part and parcel of your life.
All right, we are taking a very short break, but you're coming back with this conversation. So you can still call in. The number is on the screen. The conversation is Understanding Kidney Failure. Stay with us. You're watching Morning Cafe.
Are you ready to elevate your business game?
As long as you're earning something, there's always that opportunity to save. And you start with where you are.
Kama wewe ni mfanyabiashara, huwezi kaa bure, unajipanga taratibu vile inavyofaa.
Join us each week as we dive into the stories of the world's most driven entrepreneurs.
When you pay attention to detail, you get luxury items.
The Grind, where business meets brilliance. Tune in every Monday at 7:30 p.m. because your business deserves the best.
Hey there, friends. Welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
We're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get ready to explore with us. Join us every Saturday at 9 a.m. for new friends, amazing stories, and tons of laughter.
Join us as we explore the journeys of those who defy the odds and break barriers. We dive deep into the stories of triumph.
Sometimes when parenting a child with a special need or whatever disability, family life becomes a bit complicated and you may end up raising the child on your own.
Here, we inspire.
I have a farm which one we showcase with other dyslexic youths and autism, how to farm.
Motivate.
It's never easy, but what we do, the best thing is to work with another parent who has an elder child than yours.
And break through the barriers one story at a time. Push your boundaries beyond the limit. Saturdays at 8 p.m.
Jiunge nasi tunapoangazia safari za viongozi bora. Kutoka kwa ushindi mkubwa hadi masomo magumu.
Wakati wetu kwamba wasichana si wa kusoma, ni wa kuolewa.
All right, welcome back. You're watching Morning Cafe and we are talking matters kidney failure. And Dr. Monica is here to help us unpack this conversation and to understand what kidney failure really is. And you know, we were talking about treatment and its accessibility. I want us to go back there. You say SHA covers it, especially for Maya, right? And it only covers a percentage. This is 15%. Not everyone can afford to pay the extra fees that comes with it. Now, what happens to these people who are financially starved, financially challenged, who cannot really afford the full package of dialysis and to top up for their treatment? What happens to them?
Allow me to correct you. We talked about 15% insurance coverage.
Okay. Yeah. That is not for SHA.
Yeah.
That is general.
Yeah, that is general in the population. When they come to dialysis, SHA covers fully for that. So when you come to Maya, you not charge extra for dialysis. And remember, SHA, that is a separate package on SHA when it comes to dialysis. So all the drugs that are needed during dialysis and the dialysis process itself is fully covered on SHA at Maya. Then the medication that are taken, because at the end of the day, this patient needs supplementation because of bone issues. They need iron supplements because of anemia. That is also covered under capitation on SHA. Yeah, so SHA is able to take care of it fully, but now it depends with the cost and that whatever you're going to get. So for example, the capitation for SHA right now, outpatient is 600. You might find that is not adequate for most of the drugs because these are drugs that you're taking daily. So of course there are conversation to see how the capitation can be increased to be able to cover most of the medication. But in terms of dialysis, dialysis is fully covered. In terms of procedures that are done and for you to be able to, the access points that are created, that is either a catheter or a fistula, the procedures are fully covered on SHA. Yeah.
Do you think there are any gaps when it comes to the policy framework around this kidney care in the country, and what are they?
Of course, mostly when you look at the private insurance have better rates, of course, but when it comes to SHA, the capitation is too low because you're given, I think 600 per patient. When you look at 600 spread out through the year, and you have to do lab tests, you have to give medication, it might not be adequate, maybe for young people like ourselves, because basically for us maybe it's flus and all that. But I think the chronic care package needs to be relooked at for us, for the facilities, also to enable participation of the private facilities also. Yeah.
Maybe you could also tell us the disparities that we have when it comes to the cost in both public and private sectors. How does this vary?
Okay. When it comes to public, of course, that is the most affordable way to to access health, if it's accessible. But when it comes to cost in the private, now cost is determined by the facility. So different facilities have different costs. You might go for a urine test for public sector and it's 100 shillings or 150. You go to the local clinic, it's 200 or 250. You go to other bigger hospitals, level 4 is 500, other it's 800. So I believe the cost basically trickles down to the facility and the organization. So, but of course, when it comes, you compare the cost between the public and the private, the private is up slightly higher compared to the public. Yeah.
So what could happen if a patient doesn't seek dialysis? Yeah.
Of course, we have to look at the functionality of the kidney. What are the functions of the kidney? First of all, is fluid regulation, electrolyte balancing the electrolytes. So if you're not removing your toxins from your body, that means there's a build-up of toxins. So you end up with fluid overload, you end up with metabolic acidosis, and that's where most patients actually, that is a life-threatening condition. So you need to ensure that you cannot live without your kidneys. You cannot live without your toxins being removed from your body. So build-up will bring all those issues. Shortness of breath. When you have build-up of fluid in your lungs, that means you're having shortness of breath. If that is not taken care of, it means it will progress until you can't breathe. Fluid overload that will lead to heart failure and acute heart failure, and then you can even end up with death. So if you are below 15% functionality of your kidney, you have to get assistance in terms of filtering the waste.
Dialysis, how often is it done?
So minimum 2 sessions per week, but you can go as 4 sessions. So now it's minimal, it's 2. Because also we're looking at cost. For example, like SHA has approved 2 sessions per week. So there are people who have maybe corporate insurance, they do 3 sessions a week. Also, it's informed by how you're responding to the dialysis sessions. So maybe after 2 days, you're already having severe symptoms. The doctor might recommend after every 1 day, or maybe after every 3 days. But the minimum is 2 sessions per week. Yeah.
Are there negative effects of dialysis to the body?
Definitely, because it means you're losing a lot of, so most of the time you find there's build-up of electrolytes, like for example potassium. Most of the patient might end up with hyperkalemia, which causes arrhythmias and heart issues. There's also loss of electrolytes like calcium, there's phosphorus and magnesium that it helps in the bone density and bone mass. But we end up, most of the patients on dialysis have issues with bone So if they have stiffness, they have pain, they have all that. And then, of course, you have to be strictly monitored to avoid excess loss of fluid, because that will lead to hypovolemia. Hypovolemia will lead to acute cardiac arrest. Yeah.
And we have questions for you, Monica. This one is it true that drinking a lot of water can prevent kidney disease?
Yeah, of course, hydration is one of the way to prevent kidney disease. But of course, if you're drinking your water and your pressures are still high or sugars are still high, you're not helping. So it's a preventative measure, because, for example, when you talk about alcohol, what causes the kidney issues is dehydration. Alcohol causes dehydration. So you don't want to be dehydrated, or means your kidneys will be overworking. So of course, hydration is important, but you also have to look at all the factors holistically. Yeah.
Is it hereditary?
No, and it depends. It depends with the cause. But when you said about kidney malformation, that is genetic. When you talk about polycystic kidney disease, that's hereditary. When you talk about, also some aspect here, when you talk about hypertension and diabetes, a positive family history is very keen. So now it depends on the issue. When you talk about infections, those are not hereditary. Those are picked up in the, like hepatitis, those are picked up in the environment. So to some aspect, no, it depends on the causative ailments. Yeah.
Another question is, what should I eat to avoid kidney disease?
Okay. I always say when it comes to diet, physical, lifestyle modification, diet, physical exercise, psychological, and all that, everything in moderation. Because you need, all the foods are important, but it has been shown that plant proteins are better than animal proteins. If your diet can comprise of more of vegetables, fruits, and plant-based proteins, and then you can do occasional animal-based proteins, and then trying to avoid processed food, canned food, that to avoid the chemicals that are used in the packaging, and also reservation of the food. So that is one of the things. But everything in moderation, that's what we say.
Yeah.
If it's diet in moderation, if it's weight in moderation, because you need all the foods in your diet, but it has to be in moderation. When it comes to red meat, you have to do it in moderation, because red meat is associated with so many other comorbids. Yeah.
All right, Monica, thank you so much. We've covered a lot of ground, but as we wrap up, any advice on how to manage this kidney crisis?
So the first thing is prevention. That's what we preach at Maya. Prevention before we get to curative. So let's ensure that we are doing our annual checks. If there is something that is flagged during your annual check, always follow up to the latter to ensure it's solved. When you talk about OTC, that is over-the-counter drugs, I believe every drug you buy has a pamphlet, and there's always a section of side effects. I don't know whether anybody reads that. So try to avoid over-the-counter medication if you have to use it for a prolonged period, because you don't know what effects you're causing to your body. If you have a positive family history of either hypertension, diabetes, and such, ensure that you're doing your regular checkups in terms of sugar, blood pressure monitoring. If you've had a previous acute kidney injury, you know now your chances of getting chronic kidney injury are very high. So it's good to ensure that you check on that. There's also infection. When you have an infection and you're given a course of antibiotic, ensure you take it to the last day to ensure that the infection is cleared. Lifestyle modification like quitting smoking, reduced drinking to the recommended levels. So basic things. Hydration, like the viewer said, hydration is one of the things. So everything in moderation. Physical exercise, weight management, because obesity and overweight are one of most leading causes of also hypertension and diabetes. Yeah.
All right, that is Monica Wanjiru, a general practitioner and specialist in kidney health at Maya Kidney and Health. Thank you so much for this insightful conversation. All right, we take a very short break at this point. Fitness Thursday is up next.